Hi, I'm Joe DiMatteo of the Ask the Pharmacist Group. Thanks for being with us once again on our Health Minute, our little health talk. What is research, what is medicine not telling you about your brain? We see everything right now is all about focusing on more medications, more pharmacologic intervention, more research on the genetic links to dementia, to Alzheimer's. The reality of it is there's a couple of pieces of information that you need to know. Number one, the more sugar you consume and the higher your average blood sugar, which is termed your A1C, the greater the risk you have for developing dementia and Alzheimer's. And we're not talking about this. Number two, junk food addicts. British medical journal showed that folks that consumed more processed foods, more junk foods, more colors, more dyes, had a smaller left hippocampal tissue in the brain. Next, low vitamin D status, key marker, key factor over the course of a lifetime. Excuse me, not just as you age. So the lower your vitamin D status, the potential and the risk for dementia goes up dramatically. Multiple chronic degenerative conditions. If I'm in a very inflamed state, I have arthritis, or maybe I have rheumatoid arthritis, where there's tremendous inflammation in the body, along with a poor lifestyle, junk food diet, or too much sugar and rising blood sugars absolutely will cause damage to the brain long term. My thoughts are, as opposed to focusing on the genetics and looking for more drugs to attempt to remediate this situation, we need to be more proactive. You could be watching this, you're in your 30s, you could be in your 50s, you could be in your 70s. It doesn't matter. The more junk food, the more sugar, the more chronic degenerative conditions that you have that you don't manage, and I want to use this word very strongly, more integratively or more holistically, not just with pharmaceuticals, you run a greater risk for developing dementia long term. Swedish registry proved and showed over about a 15 to 20 year span as they followed folks, the higher their A1C, their average blood sugar, over that usually an A1C, you need about a 90-day span to see what the average blood sugar is, glycosylated hemoglobin. The higher your A1C is, the greater your risk for dementia. What is an A1C elevation? High blood sugars. If I eat too much, I eat too much of the wrong types of foods, I eat too much sugar, I eat too many processed foods, I have low vitamin D status, I drink too much alcohol, I have chronic degenerative conditions that I just manage with pharmaceuticals, and I don't try to make holistic integrative approaches. These are just 4 or 5 basic tips to preserving your brain. What is medicine? What is research not telling you about your brain health long term is the part that I think that is hurting most of us. God bless you. Thanks for being with us. I'll see you in our next Health Minute.